Hello everyone, you're welcome to another episode of Physio Nextdoor Podcast. My name is Chukwu and I am your host. As you know, I'm not usually here alone. I always have a guest speaker to do justice to whatever topic we'll be considering. And what's the topic for today? Today we are doing something special, something different. We're going to be talking about 12 myths and facts about physiotherapy. And my guest speaker, it is an honor to call in. It is an honor to welcome my guest speaker for this episode. I'll just leave her to say hi to you and give us a brief introduction about herself.
Hello, everybody. After all this hype, make I know for her, shall. My name is Michelle, Dr. Michelle Anyaoku. So I'm here with Jennifer on Physio Nextdoor, and we'll be talking about myths and facts about physiotherapy.
Yes, myths and facts about physiotherapy. Are there misconceptions you have? Are there things you've heard about physiotherapy that you're like, okay, is this what it really is? Or are there things you've heard that have scared you from going to consult a physiotherapist for whatever condition you're having? Don't worry, we're going to get clarifications on all of them today. So yes, my very own Dr. Michelle. So we're talking about 12 myths and facts about physiotherapy. Before we head right into it, I want you to tell us what are myths and facts, and then relate it to physiotherapy.
Okay, basically, myths are popular opinions that people have, but most times what makes it a myth is the fact that this is not actually true, but it's actually a popular opinion, and I'm actually very happy we're doing this because a lot of people in Nigeria don't know what physiotherapy is. I'm saying Nigeria because that is where I am. I don't know about other places. Some people, people have a lot of, I'm happy we're debunking like 12 today. People have a lot of myths about physiotherapy and they think it's the real thing. So what differentiates a myth from a fact is the fact that myth is a popular opinion that is not true, but a fact is the one that is true. It might be a popular opinion, but it's actually true. So we're here to actually, in as much as we're debunking the myths, we'll be giving you the facts too. And this is a good topic because I'm a physiotherapist, and a lot of time people, they misconstrue what I do. My younger sister one time told me she told her friend that her sister is a physiotherapist, and the person was like, oh, she works in a spa, and then she was like, no, my sister doesn't give massages, So, and these are 19-year-olds, they are teenagers, and even sometimes you'd have some patients who walk in, even those who come in, and they don't even have the full facts. I remember when we were treating and you're having a convo with the patient, and you now say something, and they're like, I thought physio was restricted to just this, so I'm happy we're doing this today because this is going to be very, very enlightening. So stay tuned. So the myths and facts, we're going to talk about all of them today.
Yes, thank you so much. We're going to talk about all of them and you will just be clarified. So I have a number of myths here. We said we have 12 of them. So I'll just read them out and you give us the facts.
All right, I got you.
The first one I have here is physiotherapy is a part of orthopedics.
This one is a very popular one. Even sometimes patients come in and I've heard somebody be like, I just came for my back, and then the person was saying something else about something like neurology, and he did not even know that physiotherapy too, there was a neurological part of it. Okay. So physiotherapy is not a part of orthopedics. Physiotherapy is physical therapy on its own, and I think now let's even say what physiotherapy is on its
Very
own.
Important.
It's a healthcare profession that is concerned with maximizing human function and maximizing movement and physical potential, So basically it's a healthcare profession on its own. Mm-hmm. Now, in physical therapy, you now have branches. Orthopedics now there's a branch of physiotherapy that is the orthopedics part of it. Ooh. But that's actually the most popular one. That because a lot of cases are orthopedics, so that's why people think it's a part of orthopedics. Physiotherapy has orthopedics, it has musculoskeletal, it has sports physiotherapy, it has women's health, there's geriatrics, there's pediatrics, there's mental health. there's actually mental health. It's not really so big in Nigeria here, but I mean, like, it is a thing. It's quite popular outside there. We did the course in final year, blah blah blah. I actually like that aspect too. I like to read up a lot on that. So there's a lot of branches of physical therapy, or like physiotherapy now. Those are the tentacles spread. So orthopedics is one of the tentacles of physical therapy. There's also the brain and spine. Let's not forget that that's the neurosurgery part of it. So it's actually like a mother to a lot of other branches. So physio is not a part of orthopedics, please. We just have a part of physio that is orthopedics, and it's the most popular. That's why a lot of people just.
I really, just as you said earlier, I like the fact that we're considering this, because not knowing this will keep people restricted. More like they are limited. They don't know that this can offer these others. So they're just like it's just this one.
Yes.
So they won't want to reach out to a physiotherapist
because they feel like I'm having this. No, it's not orthopedics. Then that's
assumptions.
Exactly.
So let's go on to the second one, and that's some patients believe that the physiotherapy clinic is just a gym center.
This one.
Okay.
Like I said, physiotherapy maximizes physical function. So definitely you're going to see your treadmill, your bicycle ergometer, the elliptical bike. So some people come in and they see all that, and then in their mind, I can come and do my gym workout here. Yeah. Now, don't get me wrong. We've had patients, but that's the thing. Patients who maybe finished their sessions and they need to keep up. Like we finished your treatment sessions and you need to keep up with certain things. They still come and use those things. You understand? But let me just say, the way a physically fine person cannot just come in and say, I want to register here just for the gym. No, it's not a gym center. For you to come for physical therapy, there's a problem. There's an ailment you're coming to us with. And then we're treating you for that. So those machines you're seeing there, those exercise machines you're seeing, it's for the treatment of the ailment you're coming with. Of which, whoever it is now, after you've recovered, you can continue. That's what makes it different from a gym center. You're not just coming to say, I want to register for the gym and come on, I'm doing workouts and all that. Those things are prescribed to you. You don't just come now and say, I want to use the treadmill, and then we just let you use it.
And then use your music box.
Exactly. So, like, if I'm telling you to go on the treadmill, then there's actually something I'm trying to achieve with that. If I'm telling you do this, there's something I'm trying to achieve with that. But also, it's just that in this part of the world, we don't do it. Outside the country, I know for a fact that every gym center is supposed to have a physiotherapist. Because we have a lot of cases where people lift wrongly at the gym. Then they come down with something, and then that's when you hear, I was at the gym, I was carrying weights, and I couldn't stand up my back just because they're lifting wrongly. We've been taught the proper way to do these things. So basically, like, we're there to oversee, like, I know they have gym instructors, they have fitness instructors, but every gym should have a physical therapist there. But it's Nigeria now, and then it's just, normal, everybody's doing their stuff. So it's not a gym center. It has those things, yes, but it's used to treat ailments. And then for those who have to continue even after they've gotten better, yes, they have the option of that. But you can't just walk in and say, I want a membership here just to come and do my workout.
Yeah, I get the difference. So I think I get that question a lot when patients come in and they get to that part.
And then they're like, can I be coming here to... It happens a lot.
It's the treatment gym. So I would like to ask, can you call that gym section, can you call it a treatment gym?
Yes. It's a treatment. It's a gym. So, even when we're like walking, always like, let's go to the gym. It's a gym. But not a fitness gym. Do you understand? It's a treatment gym. Because if I'm trying to treat you for something now, I'll be like, we time the patients or something. I could be like, we'll do 10 minutes on the bicycle ergometer, 10 minutes on the treadmill. There's a reason why I'm doing that. I'm not just doing it because I want to build your muscles and improve your cardio. So it's a gym. It is a gym, but a treatment gym, not a fitness gym. Exactly.
So take note of that. We have the gym in your physiotherapy clinic is a treatment gym and not a fitness gym.
Exactly.
All right, so let's head on to the next. We have physiotherapy is only for pain management.
This one. I've had people come in and they'll be like, I'm just in pain. Just take it away. Fine and good. Exactly. Fine and good. Physiotherapy has a lot to do with pain management. I mean, like, we basically have an entire course when we're in school dedicated to pain management. An entire course. So I understand when they say, oh, I just want you to take my pain away. But that's not all physical therapy is about. Yeah, we manage pain. There's a lot of modalities in our disposal. The STM, the TENS, the manipulations, even the machines, the ultrasound, the shortwave diathermy. We have a lot of modalities at our hands, at our disposal to manage pain and all that. But that's not all physical therapy is about. Yes. So sure, we'll manage the pain, but another thing is there's something causing that pain. So we're not just managing your pain, we're treating the root cause of it. That's the whole point. So the pain doesn't come back. Because remember then when we're being taught, when we're doing our internships and they're teaching you how to write your reports, they always tell you, you talk about like relieving pain, reducing pain. One of my chiefs was always particular about saying something. He would be like, don't say, I will take away the pain. That is not something that is entirely in your hands.
High hopes.
Yes, but when you say I will relieve, I will reduce your pain.
Okay.
And we also use the pain rating scale a lot. There's something we call pain rating scale for us.
Okay.
So basically it's on a scale of like 0 to 10. 10 is like the highest number of pain. 0 is like no pain. So when you're doing your assessment, you're always we're taught to always like the patient, like the pain is rated. So you see like along the course of treatment, we would always ask, like maybe after you've had a couple of sessions, maybe a few, you always ask, okay, what is the, you try to check the pain level now, you understand? So most times you find that if the patient walked in and let's say the pain was at 9 or 8, as your treatment goes further, you'll be hearing, oh, it's at 5 now. You understand? And then sometimes when you're done with your session, the person is complete, you'll be hearing, oh, I don't have, it's at 0 now, there is nothing. So that pain rating scale is actually like a key thing we use for pain management. So it also helps you to know what you're doing well and how to modify certain things. And another thing is what works for one person might not work for another person. And also people's pain threshold is different. So that's another thing the pain rating scale sort of helps with. So we manage pain, but it's not the only thing we do.
It's not the only thing
we do.
Honestly, physiotherapy does a lot. All right, so the next thing I have here is physiotherapists only give exercises.
Okay, clearly we don't. We give exercises, but that's not the only thing we do. But the thing is, I think, well, I've had patients who say they went to a previous clinic and then when they came in that they don't want to go, that they only give them exercises. Now, sorry to say, but a lot of people are sort of lazy. It's okay, it's fine, you know, but now the exercises that patients are given is given to them for a reason. It targets what your problem is. And one of my colleagues will always say that exercise is your holy grail, live by it. So we're very particular about the exercises we give because these things have been carefully thought out and then we're like, this is what works for this. Okay. So I think it's because of the way we're particular about the exercises that makes them say they only give exercises. Because we'll also give you like the one you do in the house. And we know because that one is going to help to keep the integrity of whatever we've done here. Yeah. So it's not when you come back, we're starting from the beginning again. So like we don't only give exercises, it's just that we're very particular about the exercises. So people now think that's the only thing. And then they're like, I don't want to do, I have a patient that comes in, she always starts with, Dr. Michelle, I don't want to do exercise today. I don't want to do, and I've kind of learned to indulge her. So what we do is after the treatment session, I don't do the exercises with her. And I tell her to do it at home. I know she might not really do it so much, or maybe even if she does, she'll do 1 or 2. But at least like I know, okay, this one is a lazy type and she doesn't really want to do exercises. But I'm treating her and we're not really doing the exercises so much. So it's not the only thing we do, but we're very particular about it. Especially in some cases. Also, you also see exercises a lot when you're managing musculoskeletal conditions, when you're managing sports. We had a group of footballers who came in sometime last week. I was very particular about that. And I'm happy because when he came in for the 5th session, he was like, he doesn't know what happened, but it's actually like a whole lot better. Because then, you know, like their muscles now is, let me say, the integrity is stronger than our own. They do all these lapses around the field. Okay. So it's not like us that we don't really work out. So them, they need those exercises. You can't be seeing a sports person and not prescribe exercises. No. Okay. All right, so
Yeah. So I was going to say something for using the example you made about the woman. So for someone who the doctor gives exercises to do, and maybe because of laziness or fear, they don't do the exercise, they don't follow it as they ought to. Is it going to affect the
outcome
of the treatment?
Well, basically they
and
say
how quick they recover and all.
yes, they say you can take a camel to the stream, but you can't force it to drink.
Yeah.
So now exercise is part of what you're supposed to do. I've given it to you.
Okay.
And you're not really doing them. If you do them, it will speed up your recovery.
Okay.
But you're not doing them. So if you were supposed to have 12 sessions with me and you're not doing your exercise, you're going to have 24 sessions. So at the end of the day, I'm not the one losing here.
Yes.
So, and then also, the person is a full-grown adult. Because we don't do it here. Outside the country, when you come in for your session, there's a form, I've forgotten what they call it, something medical, you're supposed to sign there, like, I give you the exercise, you refuse to do it. That patient will sign that the person refused the exercise willingly. Outside, they are very particular about documentation.
Okay.
So that tomorrow, if something happens, the person is not recovering, you can always go back to, you're the one who said you didn't want. But here, we're just all verbal and all. Outside, it's a thing. You refuse your exercise, you have to sign that form. That says that, I'm the one who voluntarily doesn't want to do this. And then another one is also like, if you refuse medical help at all, like physical therapy, because some people will be like, I don't want physiotherapy, you still sign that form. I've forgotten the name, so that tomorrow you won't come and say you were not giving the full standard of care. It will be there that you're the one who refused it. Exactly.
Wow. Okay, so let me just talk about, you were already mentioning something about sports.
Okay.
Good enough. I have that as one of the myths.
Okay.
Here.
Okay.
So we have that physiotherapy is only for people with fractures and sports injuries.
Okay, that's the orthopedics thing again. Because a lot of people, when they hear physical therapy, they hear people that used to fix bones. We had a patient that called in one time and he was saying, I want people to come and fix my bone. So like, some people hear physiotherapy and it's bones, and it's people that arrange bone. I've heard that one before. People that arrange bone, people that reset bone. So people think it's just fractures, and then some people know that they did a lot of people that do sports. Again, it's that same thing. There's sports physiotherapy. That one is entirely dedicated to like the sportsmanship and all those things. So it's a branch. It's not the only thing we do. And the fracture is orthopedics. It's a branch of orthopedics. Okay. So it's not like the only thing we do, but it's one of the popular ones. That's why it's out there that it's fractures and sports, but it's still a branch, basically.
Okay. Wow. So I don't know. I wanted to say, like, on football fields, do they have like physios on standby?
Every standard football club. When I mean standard, I don't mean this normal. Okay. Every standard football club has at least, and I'm saying at least, one physical therapist working with them. It's a must. Okay. That person is there. Like, this is our physiotherapist. Okay. And honestly speaking, that's where the money is. If you know how much Manchester United and Arsenal, their physios make, they are raking in the money in millions.
Of course, when the footballers are earning well,
and you're traveling with them too. Even Nigeria, that everything is not so whatever. This Afcon, the physios who went with them, they actually made a whole lot of money. So every standard football team, standard, not the low key ones, has a licensed physical therapy, because that's another thing. Because the footballers that I told you that came in, he was saying there's someone working with them, a physiotherapist. I said, is the person licensed? Because someone will come and be answering, I'm a physiotherapist, I can do the job. And I asked him, is the person licensed? And he said no. So you see, these are the problems. Like, someone who is not licensed just feels like he can just wake up and give you exercise or give you something, and he's there. So I guess maybe because he said they were not getting any better, so the boss just had to look for an alternative. And another thing that causes it is they know if you're trying to get a licensed PT, you're going to have to pay what is due. So most of these other clubs, they don't want to pay the right thing, so they'll just want to go and get a mushroom person to just do the job. That's something our body has to work on. People pretending to be physiotherapists just to pay lesser, to collect lesser amount, and then every standard football club, basketball team, like any sports, whatever, field hockey, swimming, they all have physiotherapists working with them. It's the standard. That's
really good. That's good. So we have physiotherapy is only for old people or people with chronic conditions. So the
Okay.
youngies, Gen Zs,
Physiotherapy is not easy. That is not true. Oh. That is not true. Please. That is another thing again. That's the geriatrics. Physiotherapy has a branch, or let me say, a subset that is called geriatrics. That's for old people. When I was in 400 level, we do this where you're supposed to go to different places to get your clinical experience and all that. I was posted to old people's home. It was quite tasking, but I liked it because old people, they are a different breed, trust me. At first, it might look like a lot of work because they're like children, but not children, so to speak. And then when you're dealing with geriatrics, that's old people, you have to be extra careful because they're older now, they're fragile. A lot of them, most of them don't have one condition. If you're managing one thing, there's other things with it. That's because they're old now. So maybe you're dealing with one thing. Maybe you could see someone who has knee osteoarthritis.
Okay.
And with the knee osteoarthritis, there's still spondylosis going on somewhere. Okay. And with that, probably another cervical spondylosis going on. So most of them don't have just one thing. Mm-hmm. So you're managing for a myriad of things. And another thing is, when you're working with old people, if they tell you I'm tired, respect the I'm tired. Because you know that your cardio and their own is not the same thing anymore. Your strength, and if they say I'm tired, respect it. Although some of them, they can be very naughty. They will not even do 5 minutes and tell you I'm tired. But still respect it, because if something happens, person will say I did tell you that I'm tired.
Sure.
So it's a branch of physical therapy, that's geriatrics. It's not only for old people, though. It is not, please.
Oh wow. So I think I was reading something on this and I saw something like, okay, maybe why people think it's for old people is because maybe they assume, because of this assumption that old people or certain conditions come with aging.
Okay.
So,
yes.
Back pain, knee osteoarthritis and the likes come with aging. So, for someone who is not having this, for a young person who is not having this, what's the essence? So, I think what I'm trying to say is the research said something like, we don't need physiotherapy only when there are certain conditions like this. As long as, okay, of course you have a work life, you go to work, you sit on your seat, you do certain jobs that require you maybe bend or taking certain postures that
85% of the jobs now require you to sit.
So definitely from time to time, there's no way any young person will tell me that from time to time
you've never had back pain. It's not possible.
So that is just that maybe because they just want to manage it as well. Okay, I'm too young for this now. It's not that serious, but it's actually important. And if you were trying to say that, you don't have to. You don't have to
be old or wait until it's bad for you to actually do something about it. And I mean, like, apart from the young people too, there's the pediatrics part of physical therapy where you're managing the cerebral palsy, the Erb's palsy, the DDMs, a whole lot of, and these are babies. So these are babies that are still even like trying to form. So like, like physiotherapy is a whole branch of like, it's a whole, like a big stuff that now has like tentacles. Yeah. So, it's not only for old people. You're young and you're noticing some things, and that's not about healthcare. It's easier to manage when you notice it on time. Sometimes some people will come in and then you've seen that this thing has degenerated. And I'm like, what were you doing all this while? It started 5 years ago. And I'm like, you waited 5 years before you actually came in for a consultation. So you see something, then come in for a consultation and make sure that, okay, it's not actually what you're thinking. All those, so it's not for only old people.
Great. So utilize physiotherapy even as a young person.
So you should.